Hey guys, I thought I would talk a little bit about the implant process, like from start to finish. What does it take to get from extractions to your final implant retained denture? It is a process and it does take time. I've said that before. My situation's a little different because right dead smack at the start of my treatment, the dentist I was using sold his practice and a new one came in. And so mine has taken quite a long time. It's a year, well, it's over a year this month because I started in April of 2017. But the very first thing you do is find a dentist that does implants and you need to go for a consultation, okay? During that time, they will take a 3D x-ray. It's the one where you stand up and it goes all the way around your head. That tells them if you have enough bone and the shape of your bone, like if you have enough bone for implants and if it's good bone. Some people may have to have bone grafts before they have implants. So they do that and then they draw up a treatment plan and tell you what your best options are. Now for me, I already had an idea in mind of what I wanted. I knew that I thought I wanted the mini implants and like a snap-in denture, implant retained denture, because the minis are cheaper than the regular implants and the minis take less bone. So they drew me up a treatment plan and gave me a total cost. After that, you discuss payment options, or not discuss, but you figure out your payment options. If you're going to have to finance it through Care Credit or through them, or if you're going to pay cash, okay? For me, I paid cash. I had a retirement from where I worked at a company for 11 years that I chose to take the cash option on because I was in dire need of having my mouth fixed. So once you do your treatment plan and you've arranged for pay for it, you need to be thinking about your sedation. Do you want oral sedation or IV sedation? I chose IV sedation because I cannot sit still. This surgery, implant surgery, takes at least 2 to 3 hours. That was for, I had 6 mini implants placed. So my surgery, I believe, was like 2.5, almost 3 hours. I cannot sit still that long. If you're someone that does not have trouble sitting still, I believe you would do fine with just oral sedation. They give you an anti-anxiety medication. You take some the night before. When you get up the morning of surgery, you take, they instruct you to take some an hour before surgery, and then you take the rest of the medication in with you. Of course, that is the cheaper option. Once you figured out that, your next step is going to be impressions. I had 4 teeth left on top. I've had people ask me, how did I pick out or figure out what the shape of teeth that I wanted? Well, I didn't. When they did my impressions, I still have my bottom naturals. I had 4 teeth left on top, and the temporary denture that came out, my teeth now, these are daggone near almost exactly like my natural teeth are. So they do your impressions and they get you a temporary plate ready, so that way after you have surgery you've got something to put in immediately. Okay, so after impressions, they get you scheduled for surgery. I was scheduled for extractions, and I was supposed to have the implants put in the same day. However, my extractions were pretty extensive and they required a lot of stitches. So he decided to stitch me up, put my temporary plate in, let me heal, and then schedule my implant surgery, okay? And keep in mind, after they've scheduled you for your extractions and implant surgery, you are going to get some pre-op instructions. I got a pack of antibiotics, a Z pack, which is like a steroid. I got an antiseptic mouthwash called chlorhexidine. I got ibuprofen. And then for my extractions, I got the anti-anxiety medication for my surgery. So usually what they will instruct you to do, you start the steroid medication the day before surgery. That's the steroid antibiotics. You start the ibuprofen the day before surgery, and they want you to start the medicated mouth rinse the day before surgery. The oral sedation, you start the night before surgery, okay? This starts to get your system ready because you will swell. Okay, so then you have your extractions. I waited, it was 2 months between my extraction surgery and my implant surgery. So my mouth had time to heal from extractions. I had my implants placed next. That was in August of last year, okay? Once they were put in, I believe I had stitches up there. They put those in, and my temporary plate was put in immediately after that, okay? Now, normally, I believe they want you to go at least 8 weeks after the placement of the implants before they go in and uncover them. And what I mean by uncover them is your implants are placed in the bone under in the gum. Now, when I took my plate out, most of those implants I could not see. Over on this side, the 2 implants over here, right after surgery, I could kind of see the little metal post hanging out. But for the most part, the other ones I could not see. So what they do is they go in and they trim the gum back from the implants that they placed. They trim it back to where after that procedure, you will be able to see a little bitty piece of the implant that's in. So they trim that back and they put these little healing caps on the end, okay? After they do that, they put your temporary plate back in. Okay, let me stop for just a second, guys. Okay, so that next step is they go in, like I said, and they uncover those implants and put healing caps on. Now, once I had that done, I think it was like 2 months or 6 or 7 weeks before I went back. Maybe not that long. And the next step is to do your master impression for your final snap-in plate. If you get the implant retained dentures, if you get the minis and the implant retained denture. I believe the process that I'm talking about is about the same for any type of implants you get. Unless you get the all-on-4, the type that they put in, the bridge they put in and do not take out. But the reason that my appointments were scheduled so far apart is because, like I said, my original dentist sold his practice. A new dentist came in, and he only works out of the office that I go to 1 day a week. So my appointments have been scheduled pretty far apart. So anyways, after you're uncovered, you have a master impression made. They go in, they take the healing caps off the end of the implants. They get the little tray ready. But first they take a little, it almost looks like a caulk gun, and it's got impression material in it. They tilt you back and they squirt that all around those implants. Then they have a different impression material down in the tray, and they put that in and then push up. And that makes your master impression. Once the master impression's made, the next step is your first wax try-in. Now, my first wax try-in did not have teeth on it. It was just to see if it fit my mouth, to check to mark the midline, to make sure my bite was good and make sure it was not too bulky. Now, after that, your second wax try-in will have or should have teeth on it. So you'll actually be able to see what your permanent is going to look like, okay? Okay, now, I am going for my second wax try-in with the teeth on June the 28th. I still have about 2 weeks, 2.5 weeks, 3 weeks. So, during that, I am hoping that everything looks good. As long as everything is okay with the second wax try-in and no adjustments need to be made, they send that off to make your permanent snap-in plate. Now, if there's anything that's off with that second wax try-in, of course, they will fix it and you will go back for your third wax try-in. So, this is all going to depend. It's going to be a person-by-person case situation. It just depends. I'm hoping that this next wax try-in for me, that everything looks good and I can okay it and sign off on it for my permanent. And then, of course, the appointment after that, you get your permanent, which mine will, I'll have a horseshoe denture. They'll cut, right now my temporary is a full top plate. It has the palate on it, but my permanent, the palate portion will be removed. I'll have a horseshoe set of teeth with, oh gosh, guys, I've lost my wording. But the plate will snap into the implants on top. So, this process takes time. And here is what I'm going to say to you. Do not get in a hurry. Do research, find a good dentist that's done a lot of these. But also, you don't want to pay too much. You want to find a good dentist that's got a special going on, or that doesn't charge much. And also find a dentist that's not going to rush this. You know, my stuff has taken time, but I'm glad it has, because after each separate thing I've had, my mouth has had time to heal. So, you know, I think if you're going through this, if you do decide to get implants, I wouldn't want to rush it. I would also want to make sure that after extractions, after implants, after you're uncovered, that you got some time in between those to give your, like I said, to give your mouth time to heal. But I've talked enough. If anyone has any questions at all about this process, please leave them in the comments. I'll be glad to answer. I'm really looking forward to this second wax try-in. I'm going to take you guys with me so you can see what they look like in my mouth and out. And I'm hoping that it's a perfect fit. And they can send that off for my permanent. So, you guys have a great evening. Have a great weekend. And remember, I've got 2 big giveaways coming up. We are almost to 500 subscribers. Once I get to that, that's my $100 gift card drawing. After that, once we get to 1,000, we do another big drawing, and that's another $100 gift card. So, if you're not subscribed, please subscribe. I will talk to you guys soon.